Greetings, I'm Dr. Karl Nath, the Editor-in-Chief of Mayo Clinic Proceedings, and I'm pleased to welcome you to the multimedia summary for the journal's June 2023 issue. There are 6 articles that have been selected as our Editor's Choice or Highlights articles this month. Our Editor's Choice this month is a review article entitled, "Does the combination of Finnish sauna bathing and other lifestyle factors confer additional health benefits?" A review of the evidence. It is authored by Dr. Sito Knutso from the University of Leicester in Leicester, United Kingdom, and Dr. Jari Luukkanen from the University of Eastern Finland in Kuopio, Finland. Human behavior and lifestyle are major determinants of health and disease. In Nordic countries in general, and in Finland in particular, the Finnish sauna is commonly used as a relaxing pastime. In their review, Knutso and Luukkanen assess the health benefits of Finnish sauna. Their methodology involved the review of relevant literature published in Medline and Embase from the beginning of these databases to September 2022. These studies included randomized and non-randomized controlled trials and observational studies of adults, and particular attention was directed to studies of Finnish sauna in conjunction with other factors that may determine health outcomes. A prominent such study was the Kuopio Ischemic Heart Disease Study, a prospective study of more than 2,200 Finnish men, which demonstrated that frequent sauna bathing along with high levels of cardiorespiratory fitness are associated with reduced cardiovascular diseases and all-cause mortality to a greater extent than either frequent sauna bathing or high levels of cardiorespiratory fitness alone. Not only does frequent sauna bathing synergize with cardiorespiratory fitness in conferring beneficial effects, but frequent sauna bathing may also lessen mortality associated with known risk factors. For example, frequent sauna bathing as compared with low sauna bathing mitigates the mortality risk associated with high blood pressure, systemic inflammation, and low socioeconomic status. Moreover, the beneficial effects of frequent sauna bathing may extend to non-cardiovascular diseases such as chronic obstructive airways disease, musculoskeletal diseases, and fibromyalgia, among others. The authors suggest that the salutary effects of frequent sauna bathing may involve actions that are, among others, blood pressure lowering, anti-inflammatory, and antioxidant in nature. The authors emphasize the added health benefits that accrue when frequent sauna bathing is combined with regular physical exercise, and that for individuals who are compromised in their physical activity, regular sauna bathing may mitigate the health risks incurred by physical inactivity. Regular sauna bathing may also attenuate the adverse effects of other unhealthy conditions or risk factors. The authors also provide an overview of the beneficial effects of other forms of passive heat therapy. In biology, there is a conserved transcriptional phenomenon exhibited by eukaryotic cells, the heat shock response, whereby cells mount a cytoprotective response that stoutly safeguards them against heat and a range of other imposed stressors. It is tempting to speculate that the Finnish sauna provides not only a relaxing pastime, but also a leisurely way of eliciting biology's versatile cytoprotective heat shock response. Our first highlight this month is an original article entitled "Non-Organic Behavioral Signs and Their Association with Epidural Corticosteroid Injection Treatment, Outcomes and Psychiatric Comorbidity in Cervical Radiculopathy," a multi-center study. It is authored by Dr. Stephen Cohen from Johns Hopkins School of Medicine in Baltimore, Maryland, and colleagues from other national and international institutions. The history and physical examination constitute the cornerstone in patient evaluation, as they may point to relevant diseases that require further investigation. However, Certain symptoms and signs may not necessarily be congruent with a given disease or pathologic condition, and these have been described as non-organic or behavioral in nature. Cohen et al. Undertook the current study with two objectives in mind: to examine the association between cervical non-organic pain signs and responses to epidural corticosteroid injection, and to evaluate the association between cervical non-organic pain signs with pain syndromes and psychiatric conditions. A motivation for their study was the need to improve patient selection, such that patients who undergo epidural corticosteroid injection do indeed benefit from the procedure. In this regard, Cohen et al. Drew upon their prior studies that demonstrate that non-organic signs associated with poor outcomes to such injections for low back pain. In their current multicenter study, 78 patients with cervical radiculopathy underwent epidural corticosteroid injection. Cervical non-organic signs were 9 in number and classified into 5 categories, which included non-correlative tenderness, superficial, non-anatomic, sham stimulation, head pressure, passive rotation, distraction, paradoxical response, regional disturbances, sensoriomotor, and overreaction, verbal or nonverbal. The findings demonstrate that the numbers of categories and signs strongly predicted poor outcomes after epidural corticosteroid injection. Regional disturbances and overreaction were the principal categories that correlated with negative treatment outcomes. Superficial tenderness was the most common non-organic sign. Moreover, non-organic signs exhibited a positive association with prior and concurrent psychiatric conditions and for concurrent pain syndromes. In discussing their findings, Cohen et al. Underscored 2 salient considerations. The first is that attention to the presence of non-organic signs and psychopathology may aid in identifying those patients who will not benefit from cervical epidural corticosteroid injection. Such patients are thus not subjected to an unnecessary procedure or exposed to its inherent risks. Healthcare costs are also reduced. The second consideration emphasized by the authors is that non-organic signs should not be construed as necessarily reflective of psychological pain or secondary gain. The evolving understanding of pain now recognizes that pain processing may occur anonymously, that biology, neurology, and psychology commingle in current constructs of pain, and that certain non-organic signs may indeed emanate from an organic basis for pain. The importance of the study of Cohen et al. Is that it not only advances management of cervical radiculopathy, but it also percipiently raises fundamental concepts regarding pain that may widely apply to other diseases. Our second highlight is a medley of 4 articles centered on atrial fibrillation, a disease with rising prevalence and incidence. In the editorial, The Long and Short of the Difficulties with Atrial Fibrillation Risk Prediction, Dr. Samuel Shabbatay and Dr. Samuel Asavatham from Mayo Clinic in Rochester, Minnesota, discussed the original article entitled Height Explains the Sex Difference in Atrial Fibrillation Risk, the Copenhagen General Population Study. This original article is authored by Dr. Jacob Marat from Copenhagen University Hospital in Denmark and colleagues from other university hospitals in Denmark and the United States. The third article, entitled Incidence, Risk Factors and Outcomes of Incidental Atrial Fibrillation in Patients with Graves' Disease, is the largest single-center study of its kind. This original article, authored by Dr. Joanne Nasser and colleagues from Mayo Clinic in Rochester, Minnesota, demonstrate that more than 10% of patients with Graves' disease develop atrial fibrillation, a rate significantly higher than what is described in the literature for age and sex-matched patients. For early onset atrial fibrillation, that is less than 90 days after the diagnosis of Graves' disease, risk factors include age, male sex, and overt hypothyroidism, whereas for the late onset atrial fibrillation, risk factors include age, heart failure, and COPD. Notably, late onset atrial fibrillation occurs in a substantial number of patients who are already euthyroid, a finding that led NASA et al. To emphasize the need for continued monitoring for atrial fibrillation despite achieving euthyroidism. Importantly, atrial fibrillation in Graves' disease is associated with increased risk for acute coronary syndromes, stable angina events, hospitalization for cardiac disease, and higher overall mortality. The fourth article on atrial fibrillation is an original article entitled Association Between Stable Coronary Artery Disease and Hospital Readmissions Following Catheter Ablation for Atrial Fibrillation. It is authored by Dr. Mohan Satish from Icahn School of Medicine at Mount Sinai, New York, and colleagues from this institution and from Creighton University School of Medicine in Omaha, Nebraska. There is a relatively high prevalence of coronary artery disease in patients with atrial fibrillation, and this study by Satish et al. Demonstrates that the presence of even stable coronary artery disease is associated with adverse cardiac outcomes in patients with atrial fibrillation treated by catheter ablation, including and in particular the need for readmission to the hospital within 90 days because of acute coronary syndromes and or decompensated heart failure. This assortment of 4 articles on atrial fibrillation serves to highlight the importance of this disease. The U.S. and global populations are aging, and as noted by Shabatayi and Asavatham, there may well be an age when atrial fibrillation is more the rule rather than the exception. Recognition of this disease and attempts to effectively treat it such that its complications are minimized cannot be sufficiently emphasized. You can access these highlights and editor's choice articles free of charge during the entire month of June. Please visit our Mayo Clinic Proceedings website at www.mayoclinicproceedings.org, where you'll find links to our social media by clicking the buttons at the bottom of the home page to follow us on Facebook, Twitter, and YouTube. On our YouTube channel, you'll find full-length author interviews called Insights, and our MCP 60 seconds video article synopses. Our website also includes our Mayo Clinic Proceedings issue summary and author insight podcast recordings, which are available from our website on our homepage as well as through iTunes. You will also find our online-only features and many news stories posted in the News from the Editor carousel on our website homepage that are based on articles published in Mayo Clinic Proceedings. And finally, you will see other free content as well as articles published online in press. As always, we greatly thank you for your interest in and your support of Mayo Clinic Proceedings. We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.